Hello, my name is Amir Rashid. So in this video, I'm going to be demonstrating to you on how to change a soil dressing for a patient who has had an inguinal hernia surgery. So an inguinal hernia is like any other hernia is when a part of tissue or a part of internal organ bulges through a muscle. So in this case, an inguinal hernia is when a part of your intestine bulges through the lower abdominal wall into the inguinal or groin area. So in this video, I'm going to be showing you three parts of this procedure. The first part being the introduction and the removal of the old soil dressing. The second part is the cleaning of the wound area. And the third and final part is reapplying of new dressing. Okay, so to start our procedure, well, before our procedure, we first enter the room and check whether see the patient is the correct patient that we must do the procedure on or not. To this, we ask the patient their name and their birthday, and we can check to see if it's correct. We can check their medical bag. So, sir, hello. I'm just going to ask what is your name and birthday. Okay, thank you. Okay, that's correct. So now that we have the correct patient, we can then explain to him what we are doing today. So, sir, my name is Amir Rashid. Today I'm going to be changing your dressing. So first I'm going to remove your old dressing and clean it, and then I'm just going to reapply a new one. Would that be okay, sir? Well, okay, thank you. So now you can prepare your equipment and place it on the overhead table. Now remember to place a wet protector or paper towel on the overhead table to cover it, and place your equipment on top. So here I have prepared my equipment and ready it. So I'm just going to first open up the waste contamination bag. Here. And now I'm going to expose the wound area of the patient. So, if I may please. Lift up the car. Okay, thank you. So now, once that's exposed, the patient is prepared, we have prepared equipment, then we can move on to begin our procedure. So now, to begin our procedure, we first want to wash our hands and to wear our gloves. Okay? Once you have put on your gloves, you can then begin to remove the patient's dressing. So, firstly, for the patient. So, sir, I'm going to be removing your dressing. Would that be alright? Okay. Now, if there is any pain when I'm removing dressing, please inform me, okay? Thank you. Now, we get your dressing. Remember to pull the tape and apply even pressure both on the healthy side of the skin and on the tape itself to remove it easily. So you work slowly. Okay. Okay. So remember, and then we can throw it into the waste bag here. Remember to always conceal the soiled part of the dressing away from the patient. So I'm just going to remove here. Okay, now that's done. We can then begin. Now we can assess the wound to see if there is any sort of either infection or anything, any abnormality that we might see. Okay. And from here we can see that the wound is okay. There are no abnormalities and it is clean, fine and clean. We can now dispose of our gloves and wash our hands to begin the next step, which is cleaning the wound. Okay, so now I'm going to begin cleaning the wound of the patient. So for this, I'm just going to be using antiseptic wipes and I'm just wiping it down in single strokes. So sir, I'm going to begin cleaning your wound. Will that be alright? Okay, thank you. Now I'm going to take care. That's it works. I'm just going to clean down using one stroke like this here. One single stroke. And once that's done, we can throw it away in the waste bag. Now we're going to do this. Yeah. single swipe around the wound. Now, if the patient has a surgical drain on them, then we should also clean the area by using a circular stroke from the inside of the drain to the outside, like this here. Just a simple circular motion. And we can, once that's done, we can just throw that away, also in the waste section bag. So now that's the cleaning of the wound. So if you couldn't see from the video, when cleaning the wound area of the patient using the, in this case, antiseptic wipe only using a single stroke. For me here, I'm doing a downward stroke from the wound area. I'm just doing a single downward stroke, just like that. And then once I'm done with the stroke, I will dispose of it into the waste bag. Meanwhile, if the patient has a surgical drain, we'll use a circular motion wipe around the drain, from the inside of the drain to the outside, like that. Okay, so for the final step of this procedure, I'm going to be putting on the new dressing. So for this one, I'm going to be using two layers. The first is a thinly woven one, and the second one a much thicker padding here. So sir, I'm going to be reapplying your new dressing. Okay, all right. So first, I'm going to be reapplying this thinly woven gauze first on this surgical wound. Now, if you please. All right. Okay. There. And after that, I'm going to be reapplying the thicker pad right now. Right. Make sure that your tape is evenly placed so that half of it is on the dressing and half of it goes onto the patient's skin for better secure placement. Okay. Okay, sir. And now with the dressing attached, we can so sir, how are you feeling? Are you feeling okay? Okay, you go. Okay, good. Now we can dispose of the gloves. And place it into the bag. And we can cover the patient. So, okay. So sir, how are you feeling? Are you feeling okay? Was it painful? Was it? Okay, good. So that patient is okay. We have applied a new dressing. We can then reposition the patient to a much more comfortable position, and we can do our ending procedure. That is it for my video. Thank you.